How to empower yourself financially and emotionally during menopause after 50. Hey there! Today, we're diving into a topic that impacts many women but doesn't always get the attention it deserves: navigating menopause and overcoming financial challenges. To kick things off, let's talk about Carolyn. She's a midlife woman who's starting to experience menopausal symptoms. Carolyn is juggling hot flashes, mood swings, and brain fog, and she's noticing how these symptoms are affecting her job performance. She's worried about how this phase of life might impact her finances and overall well-being. If you can relate to Carolyn's concerns, keep watching. We've got some practical advice and useful information to help you through this transitional period. First things first, what exactly is menopause? Menopause marks the end of a woman's reproductive years, typically occurring around the age of 50. According to the North American Menopause Society, menopause is defined as having gone 12 consecutive months without a menstrual period. This stage of life brings about various hormonal changes, leading to menopausal symptoms such as hot flashes, night sweats, vaginal dryness, mood swings, and brain fog. These common symptoms can significantly impact daily life and overall quality of life. Menopause is primarily driven by a decline in estrogen levels. Estrogen, a hormone produced by the ovaries, plays a crucial role in regulating the menstrual cycle and maintaining various bodily functions. As estrogen levels decrease, the body undergoes several changes. Hot flashes and night sweats, these sudden feelings of warmth, often accompanied by sweating and redness in the face and neck, are among the most common symptoms. Night sweats can disrupt sleep, leading to fatigue and irritability during the day. Vaginal dryness, reduced estrogen can cause thinning and drying of the vaginal tissues, leading to discomfort and pain during intercourse. Mood swings and emotional changes, fluctuating hormone levels can lead to mood swings, anxiety, and depression. Brain fog, many women report difficulty concentrating, forgetfulness, and a general sense of mental cloudiness, often referred to as brain fog. Other physical changes include weight gain, particularly around the abdomen, and joint aches and pains. Beyond the immediate symptoms, menopause can have long-term health implications. Postmenopausal women are at a higher risk for heart disease. The decline in estrogen levels is believed to affect the blood vessels and cholesterol levels, increasing the risk of cardiovascular issues. Estrogen plays a vital role in maintaining bone density. Its decline can lead to a decrease in bone mass, increasing the risk of osteoporosis and fractures. Some studies suggest that the hormonal changes during menopause might impact cognitive function, potentially increasing the risk of conditions like Alzheimer's disease. It's important to note that the experience of menopause varies greatly among women. Some might sail through this phase with minimal symptoms, while others might find the symptoms severe and disruptive. Factors such as genetics, lifestyle, and overall health can influence how a woman experiences menopause. Genetics play a significant role in determining how menopause will affect each woman. If your mother or sisters had a difficult time with menopause, you might be more likely to experience similar challenges. Genetic predisposition can affect the age at which menopause begins, the intensity of symptoms, and the duration of the menopausal transition. Lifestyle choices can greatly impact the severity and type of symptoms experienced during menopause. Women who maintain a healthy diet, engage in regular exercise, and avoid smoking and excessive alcohol consumption often report milder symptoms. A woman's overall health status before entering menopause can also influence her experience. Those with pre-existing conditions, such as thyroid disorders, diabetes, or autoimmune diseases, may find that their symptoms are more intense or harder to manage. Mental health plays a crucial role in how women experience menopause. Women who have a positive outlook on aging and are well prepared for this life transition often handle symptoms better. Support from family, friends, and healthcare providers can also make a significant difference. Environmental factors, including workplace stress and support systems, can impact a woman's menopause experience. Women with high-stress jobs, or those who lack a supportive network, might experience more severe symptoms. Socioeconomic status can affect access to healthcare and support services, which in turn influences how women manage their symptoms. Women with better access to healthcare resources can seek timely advice and treatment, making their menopausal journey smoother. Cultural attitudes towards menopause can shape a woman's experience as well. In some cultures, menopause is viewed positively as a time of newfound freedom and respect, which can enhance a woman's emotional well-being. In others, it might be seen negatively, contributing to feelings of shame or inadequacy. Hearing personal stories from other women can provide comfort and practical tips for managing menopause. For example, some women find that herbal supplements like black cohosh or evening primrose oil help with hot flashes, while others swear by acupuncture or hormone replacement therapy. Because every woman's menopause experience is unique, it's important to tailor treatment plans to individual needs. This might involve a combination of medical treatments, lifestyle adjustments, and alternative therapies. Consulting with healthcare providers who specialize in menopause can ensure that women receive personalized and effective care. Understanding that menopause is a highly individual experience can help women approach this stage of life with more flexibility and resilience. By recognizing the factors that influence their symptoms and seeking appropriate support, women can navigate menopause with greater ease and confidence. Menopause can also vary across different cultural and ethnic groups. For instance, studies have shown that women of color, including African American and Hispanic women, may experience more intense and longer-lasting symptoms compared to their Caucasian counterparts. Healthcare providers play a crucial role in managing menopause symptoms. Regular checkups and open communication with your healthcare provider can help in identifying the most effective treatment options for your specific symptoms. Organizations like the Mayo Clinic and the North American Menopause Society offer resources and guidelines to help women navigate this stage of life. Menopause is a natural part of aging, and while it comes with its challenges, understanding the symptoms and how they impact your body can help you manage this transition more effectively. With the right knowledge and support, you can maintain a high quality of life during and after menopause. Now, let's talk about the financial side of things. The experience of menopause can lead to significant medical expenses due to frequent visits to healthcare providers, treatments, and hormone therapy. A study by the American Journal of Managed Care found that menopause-related symptoms result in an estimated annual cost of $2,100 per woman in the United States. Moreover, severe symptoms might cause adverse work outcomes, such as missed days of work or decreased ability to perform, impacting a woman's earning potential. So, how do we tackle these financial challenges? Here are some practical tips. Knowledge is power. Understand the symptoms of menopause and treatment options available. This can help in making informed decisions about your healthcare. Resources like the North American Menopause Society and the Mayo Clinic provide valuable information. Don't hesitate to consult menopause specialists or certified menopause practitioners. They can guide you through hormone replacement therapy, cognitive behavioral therapy, and other medical treatments. Joining support groups can provide emotional and psychological support. Regular exercise can help manage symptoms and improve overall well-being. Budget for medical expenses and consider talking to a financial advisor to plan for any potential income loss. Creating a supportive environment at home and work can make a big difference. Online communities can be a valuable resource for women going through menopause. Support groups on Reddit, such as r/menopause, offer a platform where women can share their experiences, ask questions, and offer support to one another. Connecting with others who are experiencing similar challenges can be incredibly validating and empowering. Women can share tips, discuss treatment options, and simply vent about the difficulties they face, knowing that they are in a supportive environment. Every woman's journey through menopause is unique. It's a phase of life that brings its own set of challenges, but with the right support and knowledge base, it can be navigated successfully. Remember, you're not alone. Millions of American women and women around the world go through this transition. Menopause can also affect your professional life in significant ways. As women experience symptoms like hot flashes, night sweats, brain fog, and mood swings, these can impact their job performance and overall well-being at work. It's crucial for employers to recognize these challenges and create a supportive environment to help women navigate this phase of life effectively. Flexible working hours can provide much-needed relief for women experiencing menopausal symptoms. Allowing employees to adjust their work schedules can help them manage symptoms more effectively and maintain productivity. Creating a workplace culture that acknowledges and supports menopausal women can lead to a healthier, more inclusive work environment. Employers can provide resources, training, and open communication channels to support their employees. Menopause and financial challenges can be managed with the right knowledge, support, and planning. By understanding the symptoms, seeking appropriate care, and creating supportive environments at home and work, women can navigate this phase of life with greater ease and confidence. For more information, see link in the description.